My name is Danxia Yu. I'm an associate professor in the Division of Epidemiology at the Vanderbilt University Medical Center. Thank you for having me. So we all know that obesity is a major risk factor for cardiovascular disease, particularly severe obesity, which affects 1 in 10 US adults now and is growing. So previous studies have shown that bariatric surgery can reduce the risk of developing cardiovascular disease. And in this study, we applied a new cardiovascular disease risk assessment tool called PREVENT equations and apply that to evaluate the cardiovascular benefits of bariatric surgery. These new PREVENT equations consider patients' social demographic factors and renal function, and also predict the risk of heart failure, which was not included in previous risk models. So this is a collaborative project. So I work with my colleagues from multiple departments, including departments of medicine, surgery, and bioinformatics at Vanderbilt University Medical Center. We used electronic health records and create a cohort of nearly 8,000 patients aged 20 to 79 years old who underwent first-time bariatric surgery between 1999 and 2022 at Vanderbilt. The current analysis include patients who were free of CVD, so it's for primary prevention, and had complete data to calculate the pre-surgery and 1 to 2 year post-surgery cardiovascular risk estimates. The sample size ranged from 250 to nearly 3,000 patients for the present analysis. We found significant improvements in the cardiovascular, kidney, metabolic health after bariatric surgery, including lowered blood pressure, non-HDL cholesterol, and glucose, while higher HDL and eGFR. Overall, the estimated 10-year risk of developing total cardiovascular disease reduced by over 25%. And among the subtypes of CVD, we found that the risk in developing coronary heart disease reduced by 1/3, and the risk of developing heart failure reduced by over 55% 1 year after bariatric surgery. And among the patient subgroups, we found a consistent and significant reduction in the risk of cardiovascular disease, regardless of patients' age, sex, race, metabolic disease history, and bariatric surgery operation type. However, we do find patients with younger age, white race, and those who lost greater than 30% of body weight were associated with even greater risk reduction. Our findings provide this new evidence on the cardiovascular, kidney, metabolic health benefits and the prevention of cardiovascular disease, including heart failure after bariatric surgery. We hope those results can help inform pre-surgery, patient counseling, post-surgery management strategies, and potentially future research on personalized patient care. We do observe significant cardiovascular health benefits. However, the risk reduction and the health improvements varied among patients. So we are working with colleagues from multidisciplines to better understand the influencing factors and biological mechanisms underlying these varied effects of bariatric surgery. So the published study is a retrospective analysis, and we are building a prospective patient cohort to collect longitudinal data and biospecimens to answer those questions. The sample size of male patients and non-white patients are still small in our studies, and so is other bariatric cohorts. Also, the follow-up samples, particularly 2 years after surgery, is also small. So future studies with large sample size, long-term follow-up, and comprehensive laboratory assessments are needed to evaluate the sustained cardiovascular benefits of bariatric surgery and the heterogeneous effect among patient subgroups. Also, given the recent increasing use of anti-obesity medications, particularly the new GLP-1 receptor agonist, future research are needed to evaluate the combined effects of surgical and non-surgical weight loss on the cardiovascular disease risk.